Hey everyone, in this video we are going to talk about what is the anatomical snuff box. So, the anatomical snuff box, which is also known as a radial fossa, why? Because it is on the radial side. This anatomical snuff box is basically a triangular depression that is found on the lateral aspect of the dorsum of the hand. It is located at the level of the carpal bones and it is best seen when the thumb is extended. Now, the reason for its peculiar name is that in the past, this depression was used to hold the snuff, which is a ground tobacco, before inhaling via the nose. Hence, it was given the name snuff box. Now, let's see what are the borders and the contents of the snuff box. So, first of all, the borders of the snuff box. Now, these borders are 3 in number and it also has a floor and a roof. So first of all, note that these terms medial and the lateral, they are used in context of the anatomical position where the forearm is supinated. So take care when describing these borders, as when observing the patient's anatomical snuff box, the forearm is usually pronated. So first of all, we have the ulnar or the medial border, and this medial and the ulnar border, as you can see in the figure, it is comprised of the tendon of the extensor pollicis longus. Then the radial or the lateral border, so it is made up of the tendons of the two muscles, the extensor pollicis brevis and the abductor pollicis longus, as you can see in the figure. Then we have the proximal border, and this proximal border, it is made by the styloid process of the radius. Then the floor is formed by the carpal bones, which are usually the scaphoid and the trapezium. Then the roof is formed by the skin. And note that the tendons of the muscles, they are forming the border, not the muscles themselves. Now let's discuss the contents. So the main contents of anatomical snuff box are the radial artery, the superficial branch of the radial nerve, and we have a cephalic vein. Now let's discuss these contents one by one. So first of all, the radial artery. It crosses the floor of anatomical snuff box and then it turns medially and travels between the heads of adductor pollicis muscle. The radial pulse can be palpated in some individuals by placing two fingers on the proximal portion of anatomical snuff box. Then the second content, which is superficial branch of radial nerve, it is found in skin and subcutaneous tissue of anatomical snuff box, and it innervates the dorsal surface of the lateral 3.5 digits and the associated area on the back of the hand. Then we have cephalic vein. It arises from the dorsal venous network of the hand and crosses the anatomical snuff box to travel up the anterolateral aspect of the forearm. Okay, then we have some clinical relevance, or you can say the clinical significance. So what is it? So the anatomical snuff box is clinically significant when there is pain with the palpation within its boundaries. As you know, the scaphoid fractures accounts for 2/3 of all the carpal bones fractures, and they are commonly misdiagnosed. The carpal bone is typically fractured by falling on an outstretched hand, and the patient with a missed scaphoid fracture, they are likely to develop osteoarthritis of the wrist later in life. So that was all about the anatomical snuff box. I hope you enjoy the video and I hope you learned something from this video, and thanks for watching.